Hi, my name is Chisolm. I'm the educator for the Emergency Care Center here at CMC Northeast. This video is going to cover a few of the point-of-care tests that are performed in our department. Mainly the urine dip, urine pregnancy test, rapid strep, hemocolt, and gastrocult. With each of those, remember, if you're unfamiliar with any procedure, please, review the policy before performing. And also, remember to put on personal protective items such as gloves, and always label your specimens with the proper patient identifications. Usually that's stickers that are generated during their registration time in the ED. First, we're going to perform the urine dip, which we use the Siemens urine multi-sticks, which comes in a multitude of colors that we measure. We measure things like urine glucose, leukocytes, specific gravity, blood, pH, protein, urobilinogen, nitrites. First, we're going to perform this test, and on each testable item, it has the time that the manufacturer recommends that you wait in order to record your result. First, we're going to start with a cup of urine here, which this isn't real. You get your urine out, always wear gloves. You get one of the multi-sticks, dip it down in the urine completely, and you can dab off any extra urine there, and you're going to compare the colors to the results. I usually start at the bottom with glucose, and normally you would wait 30 seconds and you read across from left to right there. So glucose, you wait 30 seconds and you kind of scan across, and whatever color change is, it has a corresponding number to it. That is what you would record. Next is the bilirubin, same thing. This one waits about 30 seconds. Go across and you would record, the corresponding. This one goes from small, moderate to large. Ketones, which is the third one up, same thing. Just go across. Specific gravity, which is 45 seconds. You're just scanning across. All the way up, you would do that all the way up to leukocytes. The main thing about the leukocytes is it takes 2 minutes for this test to completely perform what it's going to do. Usually, you need to wait the actual 2 minutes, not the usual emergency department 2 minutes, which we think is 30 seconds. So take your time and go ahead and wait that 2 minutes, because some will result fast, some will take that 2 minutes to result. So that is the urine multi-sticks. That is one of the tests that we perform quite often in the emergency department. And the main one, like I said, is the urine glucose, which, again, I reiterate, it takes 2 minutes for those results to completely result out. Next is urine pregnancy test. And normally it comes in the blue and white quick view test. Again, you would need urine, properly labeled with patient identification. And you would need a pink dropper for that. Again, you fill your dropper the best you can with urine, and you're going to use 4 drops in the round window. 1, 2, 3, 4. This test has to be read within 3 minutes, not 5, not 6, but 3 minutes. It reads in a plus-minus fashion as the urine wicks across. A straight blue line is negative. A pink line down the center, making a plus sign, is positive. Any type of pink line. It can be faint pink or dark pink. Any pink, hint of pink is positive. Also, you should have a blue line in your control window. If you don't get that, that means your card is bad and you'll have to, recollect, or not recollect, but use another card. A positive result would look like that. You see we've got the pink line down the center, which would be your positive indication. Like I said, it may not look that pretty. And you should also get a blue line in the center of your control box, and that indicates that your card is a good card. Next test we do quite often in our department is the rapid strep, which you have to be careful. The package is similar to the urine pregnancy test, with the exception it has strep A down at the bottom. For that test, you would need a swab, cotton swab, as well as a plastic test tube with a dropper top to go with that, and reagents B and A or A and B. For that, you have to swab the back of the patient's throat, make sure you have a tongue blade to push the tongue down. You want to get back there. It's not a nice test, so you should get a gag reflex from them, or if you see some pustules back there, go ahead and swab those. This test, again, you should label it with patient identification. You get the test tube here goes in the round circle here. There's a circle to hold it for you. This is going to be your holder. That goes there. You're going to put in 4 drops of reagent A. 4. And 4 drops of reagent B. And it should turn green, and it should not smoke or anything like that. Next, you would swab the patient's throat, which I'm not going to do myself. Once you swab the throat, you put the swab in here, twist it around for about a minute. We'll say it's been a minute. And as you're pulling it out, you want to squeeze the sides of the test tube together to get as much germs as you can out of there and into there. Then you would use the dropper top. It goes on there. And from there, you're going to place 2 drops in the round window here. 1, 2. And again, this reads similar to the urine pregnancy test, a plus minus. Pink line down the center is positive. A straight blue line is negative. With the control box, your control line is going to be pink. Now this test takes usually 5 to 10 minutes before it results out completely. And the way you know when it's completed, you have an extra little window over here which will turn dark green or navy blue once it is completed. So that is the rapid strep test. A couple of our other tests that we perform are the gastrocult and hemocult. Hemocult is used for checking for blood and stool. To perform a hemocult test, you would need a hemocult slide. Of course, you need some stool for that. You need a slide, a stick. If you don't have that, normally doctor would order that you do a rectal exam in order to obtain a smear on your gloved finger. And you would place the specimen in both of these windows. We're going to use some fake stuff here to perform this. So you get just some poop, bowel movement put on there. You would close the window, close the cover. The manufacturer recommends that you wait about 3 minutes prior to actually applying the developer. You would open the other side. Normally you would not have color change like this immediately. You would have to apply the developer for the Hemocult, which has a blue cap on it. First you would put a drop of developer between the 2 dots on the orange control window. So you put your drop there. The positive control should turn blue, and the negative control, you won't have color change at all. So, and then you would place a drop of developer on your window, and if it is positive, you will get a color change, blue like that. Normally you don't get that pretty colorful blue. You can if the stool is grossly positive. Normally you'll see a faint blue, and that still is recorded as a positive result. If you don't have a color change, it's recorded as negative. The next type of point-of-care test we use for looking for occult blood is the gastrocult. This is used on any emesis, and with this one, you only need to put the specimen on one side, and the developer for that has an orange cap to it, so you can't mix the two. So if the doctor orders gastrocult on emesis or NG tube aspirate, you would use this here. So we're going to use the same fake specimen here. You smear your emesis on the specimen window. You place a drop on your orange control tab. Place the drop in between. And again, your positive control should turn blue. Your negative control should stay white. And after you've done that and your card checks out, place a drop on your specimen. If there's a blue halo around it or the paper turns blue around it in any fashion, that is recorded as positive. If no color change, if it remains white, that is negative. Also, doctors may order a pH. You would have to smear some emesis in that round window, and you just place a drop of developer on that window and read the color change. And there's your reference as to the colors there. You just pick whatever color it changes based on that window there. And that is most of the point-of-care testing that we perform in the emergency department. The thing to remember about ours, we record the urine pregnancy test, strep test, Hemocult and gastrocult in our AccuCheck machine. And we'll cover that on your first day with us here. Thank you.